AI will fully replace healthcare professionals.
Yeah, this one sparks anxiety fast, especially in pharmacy, because when people see AI writing notes, checking interactions, or answering drug questions, it feels like replacement is right around the corner.
Right. But across all healthcare literature I could find, and especially in pharmacy, AI consistently shows up as a support tool and not a substitute. Even the American Society of Health System Pharmacists, ASHP, statement on AI from 2025 says a common feature of current and future cases is that they, AI, are designed to augment clinical pharmacy services, not replace the pharmacy workforce.
Yeah, and keep in mind, folks, while we're using a pharmacy example here, because that's our wheelhouse, right? These same
Mhm.
concerns show up for prescribers and nurses too. And even though this sounds like a relief, are there
Mm.
good study examples backing up ASHP's claim here, Don?
Yeah. So if we look at pharmacy, for example, we do have those studies comparing AI tools, such as large language models, to pharmacists.
Hmm.
And they show that AI does have strengths, but also weaknesses, like humans, right? At least for right now. And that pattern, strong in some tasks, weaker in others, is something we see across healthcare roles and not just pharmacists. So, to the studies. One study I found compared and graded ChatGPT and clinical pharmacist answers to real life medical cases and standard test questions on a scale of 1 to 10, 10 being clearly correct.
Ah, pharmacist versus AI here. Quite the
Mhm.
showdown. This should be good.
Right. Well, ChatGPT performed equally well to the pharmacist regarding drug counseling, but it was weaker with prescription review, patient drug education, and recognizing and assessing adverse drug reactions. And for perspective, ChatGPT scored in the fours to sixes on these categories, while pharmacists were nine or above. AI tended to miss issues with complex prescriptions or gave verbose answers to patient questions, which I think does make sense.
Yeah, and well done for those pharmacists based on those scores.
Mm.
That's pretty good.
Yep. Scoring for the humans, right? But keep in mind, the study was done in 2023, and the grading was subjectively done by 5 pharmacists, and the study didn't mention any blinding.
Yeah, those are good caveats there. And 2023, that can feel like a
Mm.
lifetime ago when it comes to
Yeah.
this stuff. And it can be hard to be up to speed with these studies when technology is evolving just so darn fast, right?
Right, it seems like just exponential growth, right?
Yeah.
But on the flip side, evidence does seem to show it can help with other tasks and workflows. So another study from 2023 looked at 30 pharmacists varying 200 mock medication orders, half with AI's help and half without. And some of the mock orders intentionally had errors they needed to spot. So pharmacists made the correct decision 91% of the time without AI, but about 93 to 94% with AI. Rates were especially good with uncertainty aware AI, or AI that shares its confidence in its answer. Um, AI without this feature actually led to longer verification times compared to not using AI at all. So it could slow things down.
Yeah. So what I'm getting from that is it can help with certain tasks, especially more structured or rule based ones.
Mhm. Yep, exactly. And for some pharmacy technicians in particular, that can raise real questions about how AI fits into verification, workflow, even automation. Again, pointing to why thoughtful implementation actually matters.
And I'm also so glad you mentioned the confidence factor here earlier. AI can tell us what we want to hear and be
Mm-hmm.
confidently wrong about it, which could make you second guess things and, like you said, slow things down. So it's a really good point.
Yeah, sounds just like my wife. So, and this shows how we need to think about how AI is implemented. If implemented AI poorly without testing, that can slow us down and make us less efficient. All right, so let's go ahead and go back to that claim, which is AI will fully replace healthcare professionals. And the verdict is this is a rumor.
Yeah, I would agree with ASHP here that current evidence shows AI will change how we do tasks, but not necessarily replace us. And that applies broadly across healthcare teams, not just pharmacy staff here.
Okay. Now, something fun, Steve. I did pose this question, it's claimed to Claude, which is our own AI software, to see what it thinks the verdict should actually be.
Oh dear, I'm worried, Don. I think it'll say true, but that's because I'm a total pessimist here.
Yeah, that's pretty aware working with you this long. But actually, Claude called this rumor with conditions,
Hmm,
so
okay.
pretty close. Why? Now, why did I say condition? So here's a piece of its explanation. The claim AI, this is what they said. The claim AI will fully replace healthcare professionals is mostly a rumor, but it has a kernel of conditional truth. So, and its AI will replace or heavily shrink some tasks and some roles in some settings, especially the part that are repetitive, rules based, documentation heavy, or primarily pattern recognition with clear guardrails.
Okay. I could see its point, but I'd
Mhm.
argue a lot of our rules aren't rules-based. Healthcare is not black and white, so we can't be fully replaced, is my thinking. That said, AI won't replace healthcare professionals, but maybe those who use AI might replace those who don't, is my thinking.
Right. Yeah. Yeah, right. And later on, Claude even said, regulation and safety engineering push towards AI plus clinician, not AI instead of clinician.
Hmm.
Another good point.
Yeah,
Yeah.
that is what makes me stand by our rumor verdict. We need to keep the healthcare experts in the loop. Even AI here doesn't think it should replace us, which might be the most reassuring thing we've heard all episode so far.
Mhm. So, as an example, we do use AI in our Rumor versus Truth editorial process, mostly as a review and refinement tool. It can help us streamline ideas or even point out how bad our puns are, and it's plenty busy with that. But it doesn't create the content or make clinical decisions. That usually requires the human expert, the human touch.
Yeah, and that is similar to how we
Mm,
use AI clinically or how we should. It helps us move faster on certain tasks, but it doesn't replace judgment. We still rely on
mm,
experts to decide what's accurate, relevant, and safe. And when I think of clinical care too, the human experience is so nuanced and complicated. It's really hard to see how AI can fully replace things like empathy and compassion or even navigate complex ethical issues we see every day, at least not yet.
yeah. So I like that heartfelt point that you just gave, Steve. But it's worth looking into ways AI can help you boost your efficiency in your daily tasks. So we'll pitch out our Artificial Intelligence in Pharmacy Practice FAQ on our website for a handy list of potential uses and considerations for AI in your work. And one big theme we're seeing, and you can see it reflected in our AI resource, is that AI's first real foothold may be workflow, things like documentation, summarizing notes, helping teams spend less time clicking boxes, not replacing clinical judgment, though.
Yeah, love that resource. But
Mm.
whenever you introduce new tools into workflow, especially ones that touch patient care, the next question is always safety.